Hello, this is Dr. John Nasser from Gastroenterology, and today, in continuation of our series, I'm going to talk about a very common problem that we're facing these days, and that is COVID and digestive disease issues. So, as we all know, COVID is a virus that was discovered in 2019, and like all other viruses, COVID can cause multiple gastrointestinal problems, whether during the acute infection or during the recovery phase. So there have been multiple studies that have been done that have shown that COVID patients show gastrointestinal symptoms in around 50 to 60% of cases. And the most common symptoms that people experience are anorexia, which is loss of appetite, nausea, and diarrhea. And these happen in around 1/3 of patients, and they can continue for several weeks to even months following the resolution of the COVID infection. In around 15 to 16% of patients, gastrointestinal symptoms are the only symptoms of COVID that the patient can experience. So they don't experience any respiratory issues, but they only experience gastrointestinal symptoms such as nausea, anorexia, diarrhea, and abdominal pain. And therefore, if somebody has abdominal pain, diarrhea, and high-grade fever, or nausea and vomiting with a high-grade fever that's not improving over 2 days, please, you should get tested for COVID, because this could be an intestinal manifestation of COVID. Now, saying that, as we mentioned earlier, COVID can affect the intestinal tract, and the symptoms can last for several weeks to several months even after resolution of the respiratory symptoms. And so what do we do in this case to treat our symptoms? So it depends on what type of symptom we're experiencing. So when we're experiencing nausea, the best thing is to contact our physician to prescribe an anti-nausea medication. One over-the-counter medication that could be used in this situation is Pepto-Bismol. The second is diarrhea, and diarrhea is, as I said, present in around 30% of people who have COVID infections and may remain after the infection resolves. And in those situations, also trying Pepto-Bismol may be helpful. And if that doesn't work, then at that point in time, medications that slow diarrhea, such as Imodium or Lomotil, may need to be prescribed. Now, please make sure to contact your physician before taking any medications like Lomotil or Imodium, because you want to make sure that you don't have any other infection that may be attributing to your diarrhea, which may be more serious than a resolving COVID infection. In addition to that, it's very important to stay hydrated. Staying hydrated would definitely replete all the fluids and electrolytes that you need in the setting of diarrhea. And in the setting of anorexia, which is loss of appetite, definitely try to eat small meals rather than large meals, and try to space them over the day, and use anti-nausea medications, which would definitely help with the anorexia. And if that doesn't improve after a few weeks, and at that point in time, you need to contact your physician, as there are other medications and treatments that could be given for that type of situation. So again, as I mentioned earlier, COVID could present with gastrointestinal symptoms. Sometimes gastrointestinal symptoms are the only manifestation of COVID in around 15 to 16% of cases. And therefore, if you experience abdominal pain, nausea, diarrhea, anorexia, which is loss of appetite, or vomiting with high-grade fever that persists for more than 2 days and does not resolve, please get tested for COVID, and please contact your physician for any further questions. As always, I hope you enjoyed this episode, and please feel free to contact me on my email, john.nasser@gmail.com, or on my Instagram, _gastroclub_. Thank you, and I'll see you next episode.